Holism is not a new term. It's been going on since 2,000 years before Christ. So if you think holistic is new, nothing is new. Nothing ever is new, okay? So Chinese medicine began 2,000 years ago. 2,000 years ago, they wanted to be in harmony with nature, which is holism, right? Someone else here said that. Socrates in the 4th century said, be very wary of treating the disease. You have to treat the whole person. This is 4th century, okay? And then, so holism was around until the Industrial Revolution, okay? That's when everything changed. That was the biggest change, in fact, in our history. Okay, because everything became mechanized. Everything became, all about, it became about germ warfare. We need to kill things, right? We need to kill those germs. We need to have those manufacturing things. We need to, everything changed. The way we looked at life was totally different after the Industrial Revolution. And medicine is just one aspect of the Industrial Revolution that changed. The study of pharmacology happened during that time. And there is a Russian company that began in 1897. 1897, and it was called Bayer. Bayer aspirin started in 1897 and is still going today. Is that amazing? Okay, so there have been some great technological changes. And then in the 1920s, penicillin, Fleming made penicillin, right? So all of these important things came about. And it's very important that we have antibiotics and all these sorts of things. But with that attitude also came, we don't need to take care of ourselves because the drugs will take care of us. That's where the problem really occurred. Because if we can pop a pill to take away our pain, we do not have to worry about anything else. Did you know that 90% of all the opioids, like OxyContin, Vicodin, to give you some examples, 90% are consumed by Americans. 90% of the world's opioids are consumed in America. Is that shocking? There is a cultural disconnect here from holism. It's all about that germ warfare. Let's kill something. Let's not take responsibility for it. That is really, really important. Holistic treatment is an attitude. It is a way of life. It is a philosophy, okay? You can't say that you're holistic and only go to an allopathic medical doctor. It's a disconnect. A lot of people say they're holistic. They've never been to an acupuncturist. They've never been to a hypnotherapist. Maybe they've had 1 or 2 massages in their life. So there is a disconnect from what people, they say they're this, but they don't actually follow the principles. The principles of wholeness. The principles are the way that you live the life. To be holistic is not about verbally talking or speaking, I'm holistic. It is about actually a state of being. It is a philosophy. It is a philosophy of interconnectedness with the universe, with the world, with your community. It is about taking responsibility for your health, the way that you eat, the way that you live your life. It is all part of that theory. So we have to really look at, rather than taking Vicodin, maybe going to some yoga classes, going to some psychotherapy to look at what the cause of the pain is, or going to structural alignment with a chiropractor as some other options to medical treatment. A disease doesn't come and jump on top of you. It is created. I believe everything is created. You create your own realities. You create your own health and wellness. Okay? So allopathic medicine is about treating illness and disease. It's the way that they learn in medical school. Naturopathic treatment is about treating the symptoms so that you don't have to get to the pathology stage. Okay? There's two licenses here, ND and an MD. Okay? Both are licensed in California. Now, I'm also taking liberty here in including chiropractors and Chinese acupuncturists in the naturopathy place. So that's kind of what the difference is. Now, if I broke my foot, I am not going to go to a healer. Come on. I'm going to go to a medical doctor who knows how to do certain things. If I have whatever illness, I'm going to do that. But what I'm encouraging everybody to do is to take an integrative approach to everything that you do. The natural as well as sometimes the traditional. Sometimes you might not need to go to the traditional allopathic medicine because it can all be worked out on this side of the fence. So once you cross the line, you're in pathology. We don't want you to cross the line. There are 5 core principles of holistic health that I want to share with you. And the first one is you must treat the whole person. Okay? The second one is the mind, body, and soul are inseparable. The third one is true health is a state of being. It is not the absence of disease. Number 4, true health treats the causes, not only the symptoms. A fifth and final one is each and every one of you is responsible for your own health and need to be an active participant. The day that you do not take responsibility for your life and your symptoms, you're not living holistically. Whatever your symptoms are, it is a part of the journey that you're on. And the journey changes. A lot of us here have had changes. We've had to change careers because of illnesses. We had to be stressed, whatever. We've had to do this because of different reasons. So the process is very, very different. I want to go over holistic treatments that you may not be familiar with. Okay, I talked about naturopathy. It's an umbrella, it's an ND, they are fully licensed doctors. And they treat holistically, they treat everything from Crohn's to cancer to you name it, but from a holistic perspective. Okay? Then there's chiropractors. Chiropractors work specifically on the musculoskeletal aspects because they believe if the structure is straight, the ability for the body to align itself is way better. Okay? Acupuncturists, which I love. I go every 2 weeks. That's my treatment. That's my self-care. Okay? I go every 2 weeks. And what an acupuncture does is it works on your meridians to work on any blocks. So it also works in a physical way, in your meridian way, to remove any blocks in your system. So that's another very good way of working. There's Ayurvedic medicine. There is, let me see what else. I don't want to miss anything. Nutritional medicine, vitamins, herbs. These are all really important. These all work on the side of the fence that is before pathology. So if you don't want any pathology, you've got to work here. If you're in pathology, you can still work holistically, but you're past the line and you have to really do stuff. Now, those are just some of the basics of holistic care. Now there's a second subset that is not as medical, but is more transpersonal and spiritual, and that is sound therapy, voice therapy, yoga, power of prayer. I can't tell you how extraordinary the power of prayer is. If you are actually praying, there's a different change in your brain, I swear. It's proven. I don't have the documents because this is not that kind of talk where I have to present all these studies. But prayer, meditation, yoga, the way that you eat, Tai Chi, all of these are amazing processes, but they are not in the same capacity as a chiropractor, naturopath. You know, it's a subset. So you can't treat an illness strictly with sound therapy. It is not going to work. But if you are having an integrated approach, it works on more transpersonal and etheric bodies. Etheric meaning the energy. We are all beings of energy. So that's how it works.